usually 100% of the response is immunodeficiencies, because they know that I'm the head of center for primary immunodeficiencies. But I should say that the most common important risk factors is the older siblings, as you know. And of course, they can attend the center and immune immaturity. Some of these things we cannot very hardly affect, but we can say that we have some possibilities how can we support and how can we promote the immune maturation in the preschool age. Another very important risk factor is allergy. We know that today approximately 30 to 40% of population is suffering from allergy, and we know that allergic inflammation in the airways can lead to the increased susceptibility to respiratory infections. Which is very, very important to distinguish between those which are normally physiologically ill and those which require a little bit more investigation and examination. So we can say that in the preschool age, so in the children which are younger than 5 years, 6 to 8 episodes of upper respiratory tract infections which have mild course, which do not require antibiotic treatment, which usually lasts approximately 5 to 7 days. This can be considered something which is normal, which is expression of immaturity of immune system. You know that a lot of children in the preschool age, they do not have sufficient concentration of immunoglobulin A. They have some other minor defects in the immune system which needs a little bit time to be maturated and developed. For the older children and also for adults, 2 to 4 episodes of upper respiratory tract infections can be considered like something normal. So, just to summarize, we know that immunomodulation is an important part of prevention and treatment of respiratory tract infections. And in the first line, we should use especially natural immunomodulators. We can sometimes use also the combination of different products just to support the mechanisms of action of each other. And what is important, we should have very high purity and concentration of active substances, and we should clearly know how the particular immunomodulator is working in our immune system. We should say for the immunoglukan, we have the confirmation and the data and evidences on all of these steps regarding the use of immunomodulation in recurrent respiratory tract infections. And just to summarize, we do not need to stop this treatment if there is a case of acute infections. Even we are trying to increase the dose to support immune functions. There is no need to stop this product during the antibiotic course. There are no interesting and important interaction with some other treatment and symptomatic treatment for infections. And once acute symptoms improve, then just continue at the standard dose. So during the acute infections, we are just increasing the dose to the double, triple dosing.